improving health literacy, and mobilizing community partners. These services are provided to increase equitable access to high quality healthcare and reduce health disparities. Katie has extensive knowledge in pragmatic and fiscal trends in health and human services at federal, state, and local levels after having served over 15 years in public and nonprofit sectors. So Katie, thank you so much for being here. I will stop my share and hand it off to you.
Thank you so much. So excited to be here today. Thank you for having me. So I'm going to go ahead. I'm going to share my screen and I am going to give this a shot. So today I am going to be talking about navigating the health insurance marketplace. Ismari, if you could let me know if you can see my screen, okay?
Yes, looks great.
Awesome. All right. So navigating the health insurance marketplace. Here we go. So first and foremost, I'm going to talk about one of my favorite topics, which is the Family Healthcare Foundation. I'll give a quick little overview about who we are, what we do. So Family Healthcare Foundation is a nonprofit. We're located in Tampa Bay, Florida. And we are actually celebrating our 25th anniversary year this year. We're a nonprofit. Our vision is ensuring equitable access to affordable and high quality healthcare coverage for everybody in Tampa Bay. And we cover 4 counties: Hillsborough, Pasco, Pinellas, and Polk. We do that through the work of our navigators, who provide free application assistance for publicly funded healthcare programs. So that could be the health insurance marketplace, which I will talk to you about today. Could also be Florida Medicaid, Florida Kid Care, or local county programs like Hillsborough County Healthcare Plan or Polk County Healthcare Plan as well, which is a wonderful program. We are funded to do this work through multiple different funding programs like the Affordable Care Act, the Health Insurance Marketplace Cooperative Agreement to fund navigators. We're also generously funded by the Children's Board of Hillsborough County. We're also funded by Florida Healthy Kids Corporation, Polk County Healthcare Plans, Board of County Commissioners, Hillsborough County Healthcare Plans, Board of County Commissioners. We're very fortunate to be supported to provide this work to be free, unbiased navigators to help people find whatever option is going to be the best fit for them. To provide a little bit more context about what's happening right now and why it's so important to learn a lot about healthcare options, I'm going to talk about what's been happening the last few years. In March of 2020, with the onset of the COVID-19 pandemic, the federal government decided to inform all states that they needed to pause Medicaid redeterminations. They instilled continuous coverage requirements. And so this prohibited states from terminating everyone's Medicaid coverage and ensuring that people had access to healthcare coverage until the end of the public health emergency. So what that meant in the state of Florida was that over 2 million people gained Medicaid coverage since March of 2020. About 50% of those people were children, and over 5.5 million people had Medicaid coverage by March of 2023, which was an incredibly large number of people in the state of Florida. So in April of 2023, Florida was required to start redetermining people's Medicaid coverage. And so Florida Departments of Children and Families did need to begin redetermining people's Medicaid coverage beginning in April 2024. At that time, public health experts did determine that nationwide, almost 15 million individuals may be losing Medicaid coverage. Some may be losing that coverage due to no longer being eligible for it. They may have had a change in income, a change in family size. They just might not have been eligible for Medicaid any longer. Other people may have been losing Medicaid coverage because they might not have been receiving letters. They didn't realize they were losing coverage. And that is sometimes called administrative churn or procedural disenrollment. Either way, losing healthcare coverage can be very scary, and something that we want to ensure people are getting access to medical services and affordable healthcare coverage. So today, I'm going to be speaking about a very important topic, which is the health insurance marketplace. It is one program that may be a great fit for those that are looking for healthcare options. And it is very timely, as open enrollment for the health insurance marketplace will be coming up shortly. It is actually coming up on November 1st, and it will be running through January 15th. So the health insurance marketplace is the federal government's platform to shop for insurance. It is the official website of the United States government. It is healthcare.gov. When the Affordable Care Act was passed in 2010, it established the health insurance marketplace as a one-stop shop for individuals to look at multiple different insurance carriers and also apply for financial assistance to see if they could qualify for tax credits to lower their insurance premiums. And then possibly look at even cost sharing reductions to have lower out-of-pocket expenses for the ability to have access to affordable healthcare coverage. As I mentioned, open enrollment is coming up shortly. It is going to begin on November 1st, 2023, and it is going to be ending on January 15th, 2024. If you enroll by December 15th, 2023, your coverage will be able to start on January 1st, 2024. Ms. Mari, I'm going to stop for just one quick second because my notes paused. Give me 1 second, okay?
Yeah, no problem.
Thank you. All right, we're going to go with it. Okay, Ms. Mari, can you hear me okay?
Yeah, sounds good.
Okay, we're going to roll with it. All right, so for eligibility on the health insurance marketplace, there are a couple of key factors. Number one, you do have to live in the United States. In addition to that, you will need to be a United States citizen or a have lawfully present immigrant status. Beyond that, you cannot currently be incarcerated. In addition to that, eligibility for financial assistance is going to be based on family size and modified adjusted gross income. Generally, that is going to be based on someone's taxable income. So something that's very interesting about the health insurance marketplace, and something that I, as a navigator, and because I would love to talk a little bit more about my role as a navigator, love to share with people is the ability to window shop on healthcare.gov. Window shopping is really, really empowering for people because it takes away some of the scary parts of health insurance. And health insurance can be very overwhelming and confusing. So the window shopping tool on healthcare.gov is a great way to compare plans, look at your options and all of the different health insurance companies without actually having to create an account on healthcare.gov, and also without really having to make any commitments. You're able to type in your zip code and put in some key demographic information and then see all of the plans with, again, not actually having to create an account. It's pretty cool. We are actually going to look at some of those same features on the window shopping tool right now. And this will be the information for the 2023 year. Every year, right before open enrollment, all of the plans are available, but they're not available until the last week of October. So stay tuned, that'll be coming out shortly. So for example, I took a couple of screenshots off of healthcare.gov. As I mentioned, you can put in a zip code and some demographics, as well as an estimated income. And you can usually get an idea of how much a health insurance plan may cost. So for example, on healthcare.gov, if you are, say, a 39-year-old, you can put in an estimated amount of income. So for example, I put in on the window shopping tool the age of 39, an estimated income of $47,000, household size of 1. And I saw that that individual could get a tax credit, an advanced premium tax credit of $168 per month as an estimate. And this is really nice because on healthcare.gov, it showed that a definition right there at the bottom, that the premium tax credit was the amount to lower my monthly premium, which was very helpful. It shows me that that's not actually the premium itself. It would be able to apply to whatever insurance plan I choose. Another screenshot that I took off of the healthcare.gov window shopping tool was just the option for me to look at all the different priorities I can kind of review. So for example, I can look at some of my monthly premium options. Let's see here. I can look at, so on healthcare.gov, I can potentially review, I can choose between a premium anywhere from 167, or if I need a very low deductible plan, maybe I have a very serious medical condition and I know that I am going to need a lot of medical procedures throughout the year, I may need something that is going to be potentially a very serious health insurance issue. I might need a plan that is very expensive. That is possible. So there are plans that could potentially cost quite a bit. But there's a wide range of options available on the marketplace. In addition to that, in the zip code that I chose for this hypothetical individual, there are quite a variety of insurance companies. So the window shopping tool shows me all of those as well. So these are all the plans that are in the zip code that I use, and I chose a zip code that's in the Tampa Bay area. For the upcoming open enrollment period, most of the plans are, from our understanding, going to be all the same insurance carriers. It also shows that the deductibles are the same. So I can choose between a $0 deductible all the way up to a higher deductible. And I also could choose to look at all the different medical providers in the area. And if I wanted to make sure that my medical provider is in network, I could check that out as well. So I'm a huge fan of this tool. And I'm also a huge fan of, as a navigator, working through this first before helping people complete an application, because I think it gives people a lot of information before having them work through the application first. So after working through the window shopping tool on healthcare.gov for the health insurance marketplace, the next item that you could do is creating an account. So healthcare.gov is going to be something where you will need to fill out an application. So creating an account, it does occur on by each state. Health insurance marketplace is it's a part of the Affordable Care Act set it up so that there's the federally facilitated marketplace, and then states were given the option if they wanted to be a part of a federal exchange, they could, or they could decide to do a state-based exchange. Florida is a part of the federal exchange, which is healthcare.gov. So in the state of Florida, we go to healthcare.gov. On healthcare.gov, you set up an account. You will set up a username and password. We always encourage everyone to have a username, password, write it down. Make sure that you have security questions that you are going to recall. Keep those in a safe and secure spot. You're then going to be required to verify your identity. You'll be asked questions based on questions that would come up in a credit report. They may be questions that are pulled from federal agencies like Social Security Administration. You'll then be required to pick answers based on a list that's randomly populated. Ideally, you are going to be answering those questions correctly. Following that, you are able to apply for financial assistance on healthcare.gov. There's two forms of financial assistance to help reduce the cost of your health insurance. There is a tax credit that you can take. It is an advanced premium tax credit. Many times people are familiar with the concept of a tax credit. It is something when you file your taxes, like a child care tax credit. This is something that is given to you in advance on a monthly basis. It is something where you would be able to reduce the cost of your insurance premium as much as possible if you so choose. Beyond that, there's another form of financial assistance if you qualify for it, and that is in the form of cost sharing reductions. These are extra savings that result in paying less out of pocket, like in deductibles or copayments. You would have to choose a plan called a silver plan. There are many options on the health insurance marketplace as far as the insurance plans that you may choose. Though each of those plans are divided into 4 metal tiers: bronze, silver, gold, and platinum. In order to qualify for cost sharing reductions, if eligible, you would have to choose a silver level plan. And I have reviewed quite a few options about the health insurance marketplace and details. One of the biggest benefits that I think that the Affordable Care Act passed, in addition to the passing, or in addition to the launching of the health insurance marketplace, the establishing of qualified health plans, the ensuring of 10 essential health benefits that qualified health plans are required to instill on the health insurance marketplace was the role of navigators. So navigators are trained by the Centers for Medicare and Medicaid Services annually. We are also registered with the state of Florida. We have to be conflict-free and we have to remain objective. So as I mentioned or showed previously, we had the long list of insurance companies that are listed in the health insurance marketplace. It is incredibly important to be sure that we are not telling people which insurance plans to choose. We cannot tell anyone what plan is best for them. We can only share details and talk through what plans might help people access medical services, or what a plan might look like in the event of a medical need. I like to think that navigators are kind of like a friend who will help talk through any health insurance issue. Well, you can bounce your health insurance ideas off us. We'll talk through any health insurance event. So we're a great resource. So if you're ever confused about health insurance, you can definitely talk to a navigator. Family Healthcare Foundation's on Facebook, Instagram. We're also on LinkedIn. We also have navigators who speak Spanish, Portuguese, and Creole, as well as English. We're able to be contacted at our main office. And beyond that, we're actually part of a very large statewide consortium of navigators. Covering Florida, navigators are across the state of Florida, and they cover 67 counties. Family Healthcare Foundation is the Tampa Bay navigator partner. But we have friends all across the state of Florida, and we would be happy to connect you with any of them, no matter where you are. Maria, I'm available for questions. I went a little quicker than I thought I would today.
No, that was great. Thank you so much. Do we have any questions? I'm gonna turn on the chat again, but there is a Q&A little box that you can also submit.
Katie, I have a question. This is Teresa. What kinds of barriers or hurdles do you think exist for folks who are trying to enroll in healthcare using navigators? Are knowing what they need to have available to get their documents? What kind of problems or things might be there for folks?
It's a great question. I think we see a lot of people unsure about how to fill out the income section. So on healthcare.gov, the application is great. We've seen so many improvements to it over the years. As I mentioned, it launched in 2013. In the beginning, the application was a little hard to figure out. It was a little clunky. So lots of great advances. What I've seen most recently is that people just have a really hard time understanding how to put their income information in the way that it truly reflects how their taxable income is going to work out at the end of the year. For example, I have someone who just started working in July of 2023. So their taxable income is only going to be for half of the year. So they really should qualify for a tax credit based on July through December of 2023. But the way that the application calculated their income, it calculated it for January through December of 2023. So it's not giving them the full amount of the advanced premium tax credit that they really should qualify for. And so it made their insurance premiums kind of unaffordable for that individual. And so when the person came to me, they said, I can't really afford this. And so we talked through it, and it seemed like, and after we, they shared, what they actually were going to be making, or what their W-2 would actually reflect at the end of the year. They were able to then make an adjustment in their application, and that made a lot more sense for them on their application. So just things like that, just having a conversation about it.
And so if someone's employment status changes dramatically through the year, is there an opportunity for them to go back in and request a premium subsidy or something like that if they didn't initially qualify for it?
Absolutely. Yeah. So reporting a life change, that's part of reporting a life change on healthcare.gov. They would be able to do that. That's qualifying life event on healthcare.gov.
And are your navigators available throughout the year to help with those kind of things? I realize you probably ramped up quite a bit during open enrollment, but folks are there all year long to assist with these kind of changes. Is that the case?
Absolutely. Yeah, no, we 100% are. So we're open enrollment is certainly a busy season for us. November 1st through January 15th for open enrollment is absolutely very busy. But I think one of the great things about Navigators is that we are here all year long. So even throughout what we call special enrollment period, we're always here. And I think that's one of the great things about us is that we know that open enrollment is an important time to get people access to healthcare coverage. But even beyond that, we know that people need help finding a doctor, making that first insurance payment, helping, make sure that they know what prescription drug coverage, how do they find that prescription drug coverage, or maybe they need to add a new dependent to their plan. Maybe they're going to move. Just things like that. Life happens and they know that people still need access to healthcare coverage. So we're always here for all of those needs too.
And so when you talk about the different medal levels that were there, could you expand a little bit on what the differences are between a gold, a silver, a bronze?
Yeah, sure. So for the for gold, silver, bronze, and platinum, the ability for actually, I think it would be really helpful too if we were to look at it. I also could do a little bit of the window shopping demos too, if that would be helpful.
Yeah, that'd be
cool.
great.
That's actually one of my favorite things to do. So give me 1 second and I'll pull it up.
Okay, excellent.
All right, cool. I was wondering if that would be something we could do really quick. All right, I'm gonna do it. All right, so very quickly, let's pretend we're in Hillsborough County, Florida, and I'll go back to that. Let's go back to that 39-year-old female in Hillsborough County, Florida. Not eligible for coverage through a job, not currently a parent of a child, not currently pregnant or a tobacco user. We'll put current income, let's say, we're going to say $47,000. This was what I had used in my presentation previously. So we're saying $168 per month. That was the tax credit that was previously provided. All right, so this is the window shopping tool that I had shared before. It's on healthcare.gov/C-plans. As I mentioned, I am a big fan of that. And the reason for it is that you do not have to create an account on healthcare.gov. And it's just nice. You're able to kind of get a nice overview of all plans in that zip code without necessarily having to log in. It gives you quick definitions of everything. You can select plans to compare. You can see plans side by side. So these plan values, and then it gives you some really nice fast facts about the plan categories. And again, so in here, Teresa, this is kind of what you were saying about the different, the bronze, silver, gold, and platinum metal tiers. And it kind of just gives you a nice little overview of what the differences are between these. So without going too deep into the weeds, it goes over kind of like the metal tiers. A lot of times it goes into not necessarily the quality of the plan itself, but it does refer, the metal tiers do discuss or do reference kind of the out-of-pocket expenses that a person may be responsible for. So the lower the metal tier, the more the person's out-of-pocket expenses may be, or the lower the metal tier, the higher the person's out-of-pocket expenses may be, although the premium itself may be lower. So for example, a bronze plan, while the premium may be lower, the deductible may be much higher. So there is bronze, silver, gold, and platinum. There is a fifth plan category for some individuals who are who are younger. It is called a catastrophic plan, but it is for a younger category of individuals. So here you can see there's a bronze level. The deductible is going to be higher, and I'll show a few examples of that here shortly. So for example, here we have for the individual that we did in the window shop, we saw in the window shopping tool a 39-year-old with a $47,000 income with a tax credit of 168. There's a premium of 169 and $43 a month. They have an out-of-pocket maximum of 9,100, and the deductible is the same. So these are kind of level. Now, all of the plans, and I briefly mentioned this previously, all of the plans are required to have what's called 10 essential health benefits. Some of those essential health benefits include things like preventative services. So, for example, this plan, this is an example would be Oscar, would have what's required a preventative health care visit, vaccines that are age indicated. Those things are going to be included in this plan. But anything beyond that probably is going to be subject to this yearly deductible. Okay. Did that answer the question?
Yes, thank you. That's very helpful. For those of you who may not have been on our first session, we did do a lot of detail on what all those terms like out of pocket and deductibles mean. So we welcome you to go back and look at that on our
Was there
YouTube
anything
channel.
else?
Any other questions in the Q&A? Do we have anything? So Katie, how does somebody,
No.
do they make an appointment?
I don't know if Teresa's mic's working. I can't hear. Oh, my speaker's off.
Oh,
sorry. My bad.
That's okay. So does somebody come and make an appointment to see a navigator? How does that work? Or
Yeah, so so we have on our website, and I'll bring that up real quick as well. We have on our website, we are going to have the ability to, we have our phone number, and we also have an online scheduler. So we have, they can call, we have an online scheduler as well. For Family Healthcare Foundation, as I mentioned, we are a part of a very large statewide network of navigators. We cover Hillsborough, Pasco, Pinellas, and Polk. Beyond that, though, we work very closely with Baycare Health System, Tampa General Hospital, Evra, which is in Evra Health, which is in Pinellas, and then Premier Community Healthcare in Pasco and Hernando. So in total, there's 35 navigators in Tampa Bay, and we are honored to do this work. Anyone who goes to our website or makes a phone call is able to connect with any of those navigators.
and how soon are you taking appointments now for,
Yes,
I know we're coming up with starting November 1st, right? So
yeah, so we'll do pre-appointments to kind of connect with people and to prepare them for open enrollment. We cannot yet look at any of the plans for 2024 because they aren't released yet. So we're happy to talk with people, but until those plans are ready, we wouldn't be able to review anything with anyone.
Mm-hmm. That's great. So encourage people to book their appointments early. Imagine you get pretty busy pretty fast.
We do. We have so many appointments available. We're really excited. Yeah, we're setting our schedules, and we're getting all of our announcements ready right now. We expect we'll be very busy right now. There's a lot of people who are looking for healthcare coverage, especially with people who are losing their Medicaid, unfortunately. But we are excited to get as many people access to healthcare coverage right now.
And when you briefly mentioned the catastrophic plan, what age does that cover too? Because I know people can generally stay on a parent's plan until 24, correct? If their parents have coverage, assuming.
26.
26.
Yeah,
okay.
so people can stay on their parents' plan up until the age of 26.
Okay.
And I will follow up about that, about the ability to stay on for the catastrophic coverage.
Okay.
It escapes me. I haven't. You know what? I'm gonna have to get back about that. I will follow up. I haven't. I'll have to follow back up about that. I
Okay.
apologize.
No,
That
no.
number's escaping me.
No, it was escaping me too. That's why I
Yeah.
asked.
No, that's a good one. Yeah. I'll have to get back about that one. Usually I'm
Okay,
pretty good about
because
this stuff,
something
but
is better than nothing.
yeah, right.
Really. Yeah. Okay. Any questions from our participants anything in the chat? Ismarie, can you open up the chat to see if oh, you have opened up the chat already. I see. Okay.
Yeah, there's not anything
Else?
no.
Okay. Well, if there's nothing else, I just have a couple of things to remind everybody. Katie will be back with us again in January 26th to be talking about covering kids and kid care. So if you have people with children and are interested, or you yourself have children, please join us for that. Our next one in November is getting to know a local FQHC, which is a federally qualified health center, and they're often referred to as community health centers. These are great sources of care where you can be insured or not insured. There's sliding fee scales and other payment mechanisms, but they offer comprehensive range of services, and these are really a huge resource in our community. We want to make sure that people know more about that. And then in March 8th, we are going to have a panel discussion on services that are available for uninsured individuals. And that will be an interesting thing. We'll be looking at those county indigent healthcare plans that Katie had mentioned earlier. We'll also be looking at free clinics and some other special services that are available to assist with specialty care. So please join in for that as well. That's really good information just to have in your back pocket in case someone you know has a time when they're uninsured and still needs care. With regard to the Grubhub vouchers that have been so generously provided by Advent Health, the email that you used to register for this session will be provided to Advent Health, and they will send you that directly. So please keep an eye out for that. Check your spam folder and make sure that it hasn't gone into that, because everybody likes a free meal. So we thank them for their support of that and joining us today. We do look forward to seeing you all at our next session, and thank you so much for your time. This will be posted on our YouTube channel as well, and you will receive copies of the slides as well as an evaluation in an email that is coming up right after this session. Well, probably Monday.
Monday.
Let's look for
It'll
it
come Monday. You can enjoy the rest of your Friday, but Monday we would like to hear their feedback.
Yes, let's look for that on Monday. Ismarie, did you have anything else?
And nope, that's it. Thank you everyone for joining.
And thank you, Katie. We do appreciate your expertise.